Hi guys, I'm Emma. I just wanted to share with you my experiences of having surgery for Scheuermann's kyphosis. So I've always struggled with my posture during school, in things like PE, and even like doing the exercises in PE would just hurt a lot. About 3 years ago, I went to see a physio and to like try and fix my posture. And that was when she noticed that there was something abnormal about my back, and she actually refused to work with me because she was worried about my back and thought there was something more going on than just my posture. So she recommended that we go and see a specialist in back and spines. So we went to see him, and that's when I was diagnosed with Scheuermann's kyphosis. We had x-rays done and my curvature was measured at 62 degrees. The doctor recommended that I should get it done when I finished my HSC. I didn't think about the surgery as a possibility until 2 or 3 years later. That's when I actually decided to consider it as an option. So I'm now 19 years old, and my curve 3 years on has progressed to about 75 degrees. So I started thinking about how it might impact my future. My parents started to worry about how it might affect my body as I age, and I wasn't really happy with how it looked. So I didn't like the appearance of it, and I would get moderate pain if I was sitting and studying for a long period of time, or even just standing and bending and lifting. It was really a sudden decision for me to make because the spots were actually filling up really fast. So I decided yes, and we booked it for the 14th of January of 2014. The surgery took about 5 hours, where I woke up in ICU with some oxygen in my nose. I had an epidural. I had a catheter in my hand where all the tubes were running through. I had morphine going through there. I had the buzzer in my hand to press the morphine, and a whole bunch of other machinery. I don't remember much from ICU as I was under a lot of medication, but I do remember it being really noisy and the lights were just really bright. I kept asking for a towel to cover my face because I couldn't sleep. I had a bit of a scare when I first woke up because my right hand was numb. It was stuck in this position. I couldn't move it at all from there, and I couldn't feel anything. When I hit the side of the bed, it didn't hurt. I couldn't feel anything. I had the morphine buzzer in this hand, and I couldn't even move my thumb to press the button. They had to turn the epidural off because the numbness wasn't going away. I think maybe a day later it came back. So they turned the epidural back on, but they only put it on half the strength. I'm not going to lie, I found the week in hospital really, really tough. It's a really intense surgery. It is a lot of pain. The first 3 days were probably the worst for me. I was constantly itchy all over my body due to the medication, and I vomited a few times. During the first 3 days, you have to stay in bed. You can't really move at all. I couldn't really move my body from the waist up. I could move my legs around, but if I wanted to move somewhere, if I wanted to roll over to one side or just simply move my body up a bit more in the bed because I was too far down. I had to call a nurse to come and help me with that because I couldn't do that. I wasn't allowed to shower for a week, which was really sucked. They had to wipe me down to clean me while I was in the bed with some wipes, and they actually changed the sheets while I was in the bed, just moving me from side to side, lifting me. It was all really painful. I had to do a breathing exercise to stop infection coming into my lungs. This is the little breathing thing I had to use. So you just have to breathe into there and keep it in that area there. It was really hard. I couldn't breathe in very much. I mean, there's not much. It's like I can't expand my lungs. There's not much going on. I've improved since then, but yeah. I didn't eat much when I was in hospital because I didn't really have much of an appetite, and it was actually really hard for me to eat. I couldn't actually adjust. I couldn't elevate the bed or I couldn't get myself up enough to reach the food and feed myself. I hated it every time I had to eat. I just didn't feel like it. On the 4th day, I stood up out of bed for the first time. I was taught a log roll to get in and out of bed. And I walked with a frame, which was only to the door in my room. I didn't go very far because it's pretty intense for the first time. Everything was really difficult, even just sitting down into a chair. I couldn't sit there. I sat there for like 2 or 5 minutes and I needed to lay down. I started going to the toilet with the frame, but I still needed someone to assist me. And on the 5th day, I walked without a frame. Just to the... It wasn't that bad. Like, it was pretty good to be up and walking around. I mean, like, but I was really sore because, you know, you're in the same position for so long, for 3 or 4 days, just laying in bed. The physio took me to walk up the stairs just to, like, ensure that I could do that because I have stairs at home, which was alright. And 1 week later, my dressing was removed, and they sprayed like a synthetic waterproof skin over the top of it. That was bloody freezing. It was so cold. It's so cold that it's painful. And I got to have my first shower, which was really amazing. Overall, I'm really happy with the results of the surgery. Nothing went wrong, and my back is really straight. I don't know if you can really see how straight my back is, but the surgeon said that he got it back to 40 degrees, which is a normal curve. Naturally, the curve at the bottom of my spine here, it used to be really sunken in, but naturally it came out with the rest of it. And my stomach as well. My stomach used to I don't know how to explain it. I can't even do it. It used to stick out, purge out, but it came back in with the straightening of the spine, which is really good. I can't get over how great my posture is. Everyone says that I look really good. So it's been 4 weeks since the surgery. I'm pretty mobile. I can walk around, walk up and down the stairs. But I can't bend my back. If I need to bend, I have to bend at my knees. I can't really do much. Like right now, I wouldn't be able to go to uni or go back to work or anything like that. Sitting in the... Oh, I've been out in public a few times, but only for like short amount of time, obviously with someone else around. But I can't sit for longer than 30 minutes. After 30 minutes, I either need to lay down or go for a walk. Sitting in the car when I have to go somewhere is pretty uncomfortable. I have to have a pillow on the chair and have it reclined back a little bit. I can't see myself driving anytime soon. Mum started taking me to the pool about a week ago. I stay there for about 40 or 45 minutes. I just walk up and down the pool, do some side steps and some lunges, and I can jog in the pool, so that's pretty cool. It feels better. My back feels more relaxed when I'm in the water. It's not as heavy, so that's good. I started using a kickboard. I can kind of paddle across the pool. On the first day I went to the pool, I couldn't even bring myself forward to float. I couldn't float, I just sunk straight down. So up until now I've needed assistance in showering and dressing myself, but I actually had a shower on my own for the first time today, so that's pretty cool. I can't really show my legs, like I can, but it's really hard because you're not supposed to twist your back, and you kind of need to twist to get down there, and I can't bend down. I think laying flat on my back when I have to sleep is probably the worst position to be in. Like, it's really painful. I can now roll into my side, like sleep on my side, and I can sleep on my stomach and things like that. I still have to log roll in and out of the bed, but it's getting easier. Simple things I can't do at the moment are like putting on socks, putting on my shoes and stuff. I can't really do that. And brushing my teeth is actually a little bit difficult because the sink's so far down and I can't really bend down to spit, so it's hard. When I sneeze, it really hurts. It's just so much pressure on my back and in my chest and all that. And when I sneeze, I can kind of feel the metal rods in my back, so that's a little bit gross. My scar is going pretty well. There's no infections. I'll show you my scar, but you won't be able to see much because the steri strips haven't fallen off yet. I've taken a few off up the top, but yeah, that's about it. It's a bit of a red color at the moment. I'll just show you my scar. So starts from there down to there, so it is a pretty big scar. I don't even know if you can see it. I'm just trying to do it in front of the camera, but so that's my experience 4 weeks post-surgery. I'm planning to do another video on my progress on the 6-week mark, because that's supposed to be the recovery time, and that's when my post-op appointment is with my surgeon. And I'll probably make another one maybe at 3 months. If you have any questions, please feel free to comment below, and I'll answer them. I know what it's like to be really confused about whether or not to get this surgery done. So thank you.